Every single day, millions of people walk around with their heads feeling like they've been stuffed with wet cotton. The pressure builds behind the eyes, across the forehead, down through the cheekbones. They can't breathe through their nose. They can't taste their food. They wake up with headaches that feel like someone is drilling into their skull from the inside. And the overwhelming majority of them have been told the same thing by every doctor, every pharmacist, every well-meaning friend. Take a decongestant, use a nasal spray, wait it out. I'm gonna tell you why that advice keeps you trapped in a cycle that never actually resolves the problem. And I'm going to show you a single pressure point that drains congested sinuses in under 2 minutes, a technique that has been used for thousands of years in traditional medicine, and that modern research has now confirmed through documented physiological mechanism. But before we get there, I need you to understand exactly what's happening inside your head right now and why the conventional approach fails almost everyone who tries it. Subscribe to Dr. Waterling right now and hit that like button. We're working toward building this channel on one principle: giving you the information that actually works, the techniques that restore your health without dependence on products that never solve the root cause. Every subscriber moves us closer to reaching people who need this information. Let me be direct with you. Chronic sinus congestion is not a minor annoyance. In medicine, we recognize it as rhinosinusitis, and when it persists for more than 12 weeks, it becomes a chronic condition affecting approximately 37 million Americans every single year. That's not a small number. That's more than 1 in 10 adults walking around with inflamed sinus cavities that refuse to drain properly. And here's what nobody tells you. Chronic inflammation in those cavities doesn't stay localized. It spreads. It affects your sleep quality because you can't breathe lying down. It triggers secondary infections because stagnant mucus becomes a breeding ground for bacteria. It causes facial pain that radiates into your teeth, making you think you have dental problems when the issue is actually 6 centimeters above your jaw. The sinus cavities are not simple hollow spaces. They are complex air-filled chambers lined with delicate mucous membrane tissue connected to your nasal passages through narrow openings called ostia. These openings are remarkably small, some of them only 2 to 3 millimeters in diameter. When that tissue swells even slightly from inflammation, those drainage pathways close. The mucus that your sinuses produce normally, about 1 liter per day across all sinus cavities combined, has nowhere to go. It accumulates, pressure builds, and your body's immune response, trying to fight what it perceives as an infection, creates more inflammation, which closes the drainage pathways even tighter. This is the trap. The more congested you become, the more inflammation your body produces. The more inflammation you have, the more blocked the drainage becomes. Conventional medicine tries to break this cycle with decongestants that shrink swollen tissue temporarily, or corticosteroid sprays that reduce inflammation. And yes, these interventions provide relief for some people in acute situations. But here's what I saw in 15 years of clinical practice. Patients using these products week after week, month after month, never actually resolving the underlying problem, because shrinking tissue with medication doesn't restore the mechanical drainage that gravity and normal sinus function depend on. Your sinuses drain through specific pathways that rely on both gravity and the tiny hair-like structures called cilia that line the sinus cavities. These cilia beat in coordinated waves, moving mucus toward the drainage openings. When inflammation disrupts this system, when the openings are blocked, when the cilia become paralyzed by chronic irritation, no amount of chemical decongestant restores normal mechanical function. The medication wears off. The swelling returns. You reach for the bottle again. The healthcare industry profits from this cycle. There is no revenue model in teaching you a pressure point technique that costs nothing and requires no products. Your next appointment will not include instruction on manual lymphatic drainage or acupressure points that facilitate sinus clearance, because there is no billing code for that education. The system is built to sell you sprays, pills, and eventually, when those fail long enough, surgical procedures to widen blocked sinus openings. I'm not saying those surgeries are never necessary. I'm saying that a substantial percentage of people suffering from chronic congestion never needed pharmaceutical intervention or surgery in the first place. They needed to understand how to mechanically restore drainage. Now, let me explain exactly what happens when you apply pressure to a specific point on your face and why this technique works when decongestants fail. The pressure point I'm about to show you is located at the junction where three separate anatomical structures converge: the maxillary sinus cavity, the nasal bone, and a cluster of lymphatic vessels that drain fluid from the entire midface region. When you apply firm, sustained pressure to this exact location, you create several simultaneous effects. First, you mechanically compress the swollen tissue in the immediate area, forcing accumulated fluid out of the inflamed membranes and into the lymphatic drainage system. Think of it like squeezing a sponge. The tissue is saturated with inflammatory fluid that has nowhere to go because the normal drainage pathways are blocked. Direct pressure creates a new pathway by forcing that fluid into the surrounding lymphatic vessels. Second, you stimulate sensory nerve endings that trigger a reflexive response in the autonomic nervous system. This is not mysticism. This is documented neurophysiology. The trigeminal nerve, which provides sensation to the entire face, has branches that pass directly through this area. When you apply pressure, you activate nerve fibers that send signals to the brainstem, triggering a parasympathetic response that dilates blood vessels and reduces inflammatory mediator release. The swelling decreases not because of a chemical drug, but because your own nervous system receives a signal to reduce the inflammatory response. Third, you create vibration and mechanical stimulation that reactivates the cilia lining your sinus cavities. These tiny structures become paralyzed in chronic inflammation, lying flat and motionless instead of beating in coordinated waves. The mechanical pressure and release pattern literally wakes them up, restoring their ability to move mucus toward the drainage openings. This is not traditional folk medicine that happens to work through placebo effect. This is documented physiological mechanism that researchers have studied using imaging technology and pressure measurements. A study published in the Journal of Alternative and Complementary Medicine measured sinus pressure before and after acupressure intervention and found statistically significant pressure reduction within 3 minutes of application, with effects lasting an average of 4 to 6 hours. That's comparable to pharmaceutical decongestants, except there are no side effects, no rebound congestion, and no dependency. Here is the exact technique, step by step, with anatomical precision, so you can locate the point accurately and apply pressure correctly. Sit upright in a chair with your head in a neutral position, not tilted back or forward. Place your index and middle fingers on one side of your nose, right where the hard nasal bone meets the softer tissue of your cheek. You'll feel a slight indentation there, a small hollow space. That is the location. Now slide your fingers approximately 1 centimeter upward and outward toward your eye. You should now be pressing on the bony ridge just below the inner corner of your eye socket. This is the exact point. Apply firm pressure using both index fingers simultaneously on both sides of your nose. The pressure should be strong enough that you feel distinct sensation, but not painful. You're compressing the tissue between your fingertips and the bone underneath. Hold this pressure for exactly 30 seconds. You may feel tingling, warmth, or a sense of fluid movement behind your face. That is normal. That is the lymphatic drainage beginning to activate. After 30 seconds, release the pressure completely for 10 seconds, then reapply for another 30 seconds. Repeat this cycle 3 times total. During the final 30-second hold, add a gentle circular massage motion with your fingertips, moving in small circles while maintaining the pressure. This enhances the lymphatic drainage effect. Now, immediately after completing the 3 cycles, tilt your head forward so your chin moves toward your chest. Stay in this position for 60 seconds. Gravity will now assist the drainage you've just activated, pulling the released fluid downward and out through your nasal passages. You will likely feel mucus begin beginning to move, your nose may start running, you may need to blow your nose. This is exactly what should happen. This is successful drainage. I need to tell you about a patient named Robert, age 62, who came to my office after 18 months of chronic sinus congestion. He had tried every over-the-counter decongestant available. He had used prescription corticosteroid nasal sprays for 6 months. He had undergone 2 courses of antibiotics for suspected sinus infections. He was scheduled for a surgical consultation to discuss balloon sinuplasty, a procedure that would cost him approximately $8,000, even with insurance coverage. He was exhausted, sleeping poorly, experiencing daily headaches, and convinced he needed surgery. I examined him and found moderate inflammation, but no structural abnormalities that would require surgical intervention. I taught him this exact pressure point technique and had him perform it in my office. Within 90 seconds, his right sinus cavity began draining. Within 3 minutes, both sides were clearing. He looked at me with an expression I'll never forget, a mixture of relief and anger. Relief that it worked, anger that nobody had shown him this in 18 months of medical appointments. I instructed him to perform the technique 4 times per day, upon waking, mid-morning, mid-afternoon, and before bed. I also gave him a simple saline rinse protocol to use after each pressure point session to clear the loosened mucus. He returned 2 weeks later and canceled his surgical consultation. Within 6 weeks of consistent daily application, his chronic congestion had resolved completely. He still uses the technique occasionally when he feels congestion beginning, and it prevents the buildup before it becomes chronic. That case is not unusual. In 15 years of clinical practice, I have seen this technique work for hundreds of patients when conventional approaches failed. This is not anecdotal folk wisdom. This is reproducible physiological intervention that works because it addresses the mechanical problem directly instead of temporarily masking symptoms with chemicals. Now, you need to know when this technique is appropriate and when it is not. If you have acute bacterial sinusitis, meaning you have thick yellow or green nasal discharge, fever above 38 degrees Celsius, severe facial pain on one side only, and symptoms that are getting worse instead of stable, you need medical evaluation. That may require antibiotics. The pressure point technique supports drainage, but it does not replace antibiotic treatment for active bacterial infection. If you have structural problems including a severely deviated nasal septum, nasal polyps that completely block your airways, or previous facial trauma that changed your sinus anatomy, the pressure point technique may provide only partial relief. You may need medical imaging and possibly surgical correction, but even in those cases, the technique can improve drainage of the functional portions of your sinus system. If you are taking blood-thinning medications or have a bleeding disorder, apply the pressure gently. Aggressive pressure on facial tissues while on anticoagulants can cause bruising. The technique still works with moderate pressure. You don't need to press hard enough to cause pain or tissue damage. Here is your complete protocol, organized into a daily implementation schedule that maximizes effectiveness. Morning. Within 15 minutes of waking, perform the 3-cycle pressure point technique exactly as described. After completing the technique and tilting your head forward for drainage, prepare a simple saline rinse. Mix 1/4 teaspoon of pure sea salt into 250 milliliters of warm distilled water. Use a neti pot or nasal rinse bottle to flush both nasal passages, allowing the drainage and loosened mucus to clear completely. This takes approximately 3 minutes total. Mid-morning, approximately 3 to 4 hours after waking. Repeat the pressure point technique. You don't need the saline rinse at this session unless you feel significant mucus accumulation. The goal is preventing buildup rather than just treating existing congestion. Mid-afternoon, approximately 6 to 7 hours after waking, repeat the pressure point technique. If you work in an environment with dry air, air conditioning, or airborne irritants, this session is particularly important because it clears accumulation before it triggers the inflammation cycle. Before bed, within 30 minutes of lying down, perform the pressure point technique followed by the saline rinse. This is critical because lying horizontal makes sinus drainage more difficult. Clearing your sinuses before bed prevents the nighttime congestion that disrupts sleep and causes morning headaches. You should notice improvement within the first 24 hours. Most people experience significantly reduced pressure and improved breathing after the first morning session. By the end of the first week, if you're performing the technique consistently 4 times daily, you should have noticeably better drainage, reduced headaches, and improved sleep quality. Within 2 to 3 weeks of consistent application, chronic congestion typically resolves completely. How old are you? Write it in the comments. I want to see which age group makes up the majority of our viewers because it will directly shape what I cover in future videos. Now, there are several factors that enhance the effectiveness of this technique and several factors that undermine it. Let me give you the complete context so you maximize your results. Hydration status directly affects mucus consistency. If you're dehydrated, your mucus becomes thick and sticky, making it harder to drain even when you successfully open the drainage pathways. Aim for approximately 2 liters of water daily, more if you're in a dry climate or taking medications that have dehydrating effects like antihistamines. Humidity in your environment matters significantly. Indoor air, especially during winter heating or summer air conditioning, often has humidity levels below 30%. Your sinus membranes function optimally at humidity levels between 40 and 60%. Consider using a cool mist humidifier in your bedroom during sleep. This prevents the overnight drying that makes morning congestion worse. Inflammatory foods can perpetuate the cycle. Dairy products increase mucus production in approximately 30 to 40% of people, though this varies individually. Refined sugar and processed grains trigger inflammatory responses that affect sinus tissue. You don't need to eliminate these foods completely, but notice whether your congestion worsens after consuming them. If it does, reducing intake will enhance your results significantly. Allergen exposure obviously affects sinus inflammation. If you have confirmed environmental allergies to dust mites, pollen, or mold, the pressure point technique will still work, but you'll need to use it more frequently during high exposure periods. The technique doesn't cure allergies, but it prevents the congestion that allergies trigger from becoming chronic and self-perpetuating. Physical position during sleep affects drainage. Sleeping completely flat makes drainage difficult even with clear passages. Elevating your head approximately 15 to 20 centimeters using an extra pillow or wedge creates a slight angle that assists gravitational drainage throughout the night. This simple adjustment often reduces morning congestion by 50% or more. If this video helped you, send it to someone you care about, a friend or family member who's been suffering with chronic sinus problems, someone who's been using sprays and pills for months without real resolution. You may have just given them a technique that changes their daily quality of life. The pressure point technique I've shown you today represents something larger than just sinus drainage. It represents a principle that applies across many health conditions. Your body has inherent mechanisms for restoring normal function, and often those mechanisms just need proper activation rather than pharmaceutical suppression of symptoms. The medical system profits from selling you products that manage symptoms perpetually. There is no profit in teaching you techniques that resolve problems permanently using nothing but your own fingers and 2 minutes of time. I'm not telling you to reject all medical intervention. I'm telling you to understand when simple mechanical solutions address the root cause more effectively than expensive pharmaceutical management. For chronic sinus congestion without structural abnormalities or active infection, the pressure point technique works. It works reliably, it works repeatedly, and it costs you absolutely nothing except the time to learn proper technique and the discipline to apply it consistently. Subscribe to Dr. Waterling right now if you haven't already. Help us reach more people who need this information. We're building this channel on the principle that healthcare should empower you with knowledge and techniques that restore your body's normal function. not create dependency on products that manage symptoms indefinitely while the underlying problem persists. Your sinuses are designed to drain. When that drainage is blocked, pressure and inflammation follow. But you now have a technique that restores the drainage mechanically, that works with your body's own systems, rather than suppressing them chemically. Use it consistently. Give it 2 weeks of 4 times daily application. And notice how different you feel when your head is clear, when you can breathe freely, when the pressure behind your eyes disappears completely. That is not too much to hope for. That is normal sinus function, and you just learned how to restore it.